Diabetes Connections is brought to you by inhaled insulin, glucose management in the moment, by Omnipod, simplify life with Omnipod 5, by Dexcom, manage diabetes confidently and achieve real results with Dexcom G7, the powerfully simple CGM, and by Edgepark, simplify your diabetes journey with Edgepark.
This is Diabetes Connections with Stacey Sims.
This week, Dexcom's Chief Operating Officer, Jake Leach, talks to me about G6, G7, trends in CGM, what the company has its eye on next, and he answers a lot of your questions. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Hello and welcome to another week of the show. I am so glad to have you here. I'm your host, Stacey Sims. You know we aim to educate and inspire about diabetes with a focus on people who use insulin. Before we get to the interview with Jake, I am so excited by this news. I just have to share this with you. It will be in the news episode coming out on Friday. Many of you saw that two scientists won the Nobel Prize in Medicine for discoveries that enabled the creation of the mRNA vaccines against COVID-19. Catalin Carrico and Drew Weissman. What you may not know is that Drew Weissman has lived with type 1 diabetes for almost 60 years. There was no big announcement about this, but you could see in some of the photos from a couple of years ago when they started rolling out the vaccines that he was wearing an insulin pump. And so people got curious. There's a great article from Diabetes Mine. I miss Diabetes Mine. I will link that up so you can read it. That's just great stuff. Something else you should know about as you listen, we are this close to Mom's Night Out Frisco. Registration closes this Sunday, October 8th. So if you have been on the fence, go ahead and get your ticket now. That's at diabetes-connections.com. Click on the events tab or you'll see it right on top. We will be in Providence later this month on the 27th, back in Charlotte in February. Mom's Night Out is a new 2-day conference for moms of kids with diabetes. Okay, my guest this week is Jake Leach, Dexcom's Chief Operating Officer. They are presenting, like so many, at EASD, the European Association for the Study of Diabetes. Quick disclaimer, if you are new around here, Dexcom is an advertiser. You've already heard me talk about them a little bit, and there will be an ad toward the end of the show as well. My son has used a Dexcom for almost 10 years now, and they advertise because we believe in the product. But that doesn't mean they tell me what to say or what to ask. They absolutely do not. I appreciate all the questions you sent in. I got to as many as I could. My interview with Jake coming up right after this. How many times have you miscalculated timing of a mealtime insulin dose? Well, this happens to us a lot. Benny will dose after he orders, and then the restaurant gets busy. Your meal takes longer than expected, or he will just forget or bolus too late and then have to deal with high blood sugars. If that happens to you, it might be time to think about Afrezza inhaled insulin. Afrezza uses a breath-powered inhaler to quickly deliver insulin powder into the lungs and bloodstream. It's fast in, fast out. In fact, with Afrezza, insulin is released into the bloodstream in less than 1 minute and may start to lower blood sugar in about 12 minutes. Ask your doctor if Afrezza is right for you. Go to diabetes-connections.com and click on the Afrezza logo. Afrezza can cause serious side effects, including sudden lung problems and low potassium. It's not for patients with chronic lung disease such as asthma or COPD or for patients allergic to insulin. Tell your doctor if you ever smoked, ever have kidney or liver problems, a history of lung cancer, or if you're pregnant or breastfeeding. Most common side effects are low blood sugar, cough, and sore throat. Severe low blood sugar can be fatal. Do not replace long-acting insulin with Afrezza. Afrezza is not for use to treat diabetic ketoacidosis. Please see full prescribing information, including boxed warning, medication guide, and instructions for use on afrezza.com/safety. Jake, welcome back. It's always great to talk to you. Thanks for joining me.
It's an absolute pleasure to be here, Stacey.
Give me a little context. Where are you right now?
Yeah, so I'm on the ground here at the EASD conference in Hamburg, Germany, where lots of great data was just presented around the use of CGM and quite a few different patient populations and some really exciting outcome data.
Let's jump right in and talk about what was just presented. Can you tell me about, and I hope I'm pronouncing this correctly, the Commiss study?
You got it. You pronounced it perfect. Yeah, the Commiss study. It is the longest prospective real-world study of CGM ever. So this study was started back in 2013. That was when it was first conceived. It was basically, it's an exciting study. It was designed to look at long-term outcomes of CGM over multiple years. And now this year, we just did the 7-year readout of the study. So 7 years of the study ongoing. It was designed to compare CGM use with SMBG finger sticks. And in the both the SMBG group and the CGM group, there is MDI users as well as open loop insulin pump delivery. And so there's 4 cohorts in the group. And this Dr. Jan Sopel from the Czech Republic is the one who conducted the study, and he has followed this group of people for 7 years. And what we have seen in the data is dramatic and sustained A1C improvements for people using CGM, whether they're using MDI or pump therapy. It's very similar. A1Cs are basically overlapping. This population started around 8%. A1C a little bit higher than that. Using CGM, whether it's MDI or on a pump, they were able to reduce it to just above 7, like 7.1, and sustain that for over 6 years. And so that was exciting. And then the next thing that was done in the study was the introduction of hybrid closed loop a couple of years ago when the Tandem Control IQ became available. The group that was on insulin CGM combined with insulin pump therapy moved on to AID. And we saw another significant reduction in A1C that went down to about 6.5%. And that was sustained since the product was available. So for the last couple of years, that subgroup of is seeing great results. And so my takeaway from it is just the big sustained impact that CGM can have for users, which isn't a surprise, but it's nice to see this really long longitudinal data. And then also the impact that the hybrid closed loop, in particular, Control IQ had for this population. That was great. There's also a really exciting output around learning around how CGM. One of the things they tracked in the study was diabetic retinopathy. What they saw in the finger stick group, so this group that stayed on finger sticks for the whole time, was a 3-fold increase in diabetic retinopathy, where in the CGM group, there was not an increase for that whole period of time. So really kind of pretty strong outcome data showing not just A1C benefits, but the extended benefits of using CGM.
I would assume, I didn't read the entire study, just the summary you guys sent over this morning. I assume that the drop in retinopathy came with the drop in A1C. There wasn't something different in there. Okay.
No, it was basically, a better glucose control. And, I think that it's just another great proof point in that group that shows the outcomes you can get.
Great. Couple of quick little point of order clarification questions. The study started in 2013, went on for 7 years. What am I missing? Did it conclude 3 years ago?
We basically started but the study in real time. It was conceived in 2013. This is the 7-year readout, which was actually, they basically took the data to do all these analyses, and it's going to continue going. So Jan's going to continue running this study.
That was my next question, because who knows what we'll find in the next 7 years.
Yeah, they're looking at some of the other complications of diabetes, like kidney disease. That's one of the other. He's still analyzing that data at the 7-year time point, so we didn't get that yet. But he is planning to publish this data as well. So I think we'll get even more info from the publication.
It's funny to think back. I think 2013 is when Benny started using a Dexcom. And we're thinking about how the models have changed, right? How there have been improvements and features. Did the folks in the study use the same model, CGM, throughout? Did they change? Did they finish on G6?
So they're on G6 now. So they started with G4. And then went to G5, and then now are on G6. They progressed through all the different systems over time.
Before we move on to listener questions, just another question about this study. You said in there, not a big surprise, right? And I think for most people listening to the podcast, they're thinking, well, duh, of course, if you use a CGM, whether it's with MDI or with a dumb pump or a smart pump, you're going to get better results, because why wouldn't you? But can you take a second to talk about why studies like this and continuing studies like this are important for insurance reasons, or people who are newly diagnosed who aren't on top of all the information like so many of my listeners are?
Yeah, it's a great question. I think one of the things about this study in particular is it's a real world study. So it's not a controlled clinical study over a short period of time, which is often what you can run and get the data out there quickly. But there's always questions around how did the study design impact that? The duration, are those results really able to be sustained? And so studies like this show that the A1C improvements in this study and in many others are seen really dramatic, really quickly, right? Within the first 3 months, and then often, they get a little bit better even through 6 months. But then, you basically see that large improvement, but then can that be sustained? And the other thing is, are people willing to continue using CGM, right? And once they get that benefit, do they remember that's where it came from? So I think that's also another important part of these real world studies is showing the utility of the products and the staying power that people have once they start using them and how the benefit continues to be sustained.
All right. So as usual, I have a bunch of questions from my listeners. So we'll go through and we'll see what you can answer and what you can't. The first one I think is top of mind for many people, but it isn't really a Dexcom question. I'll ask it anyway. Any update on connectivity, you know what's coming, for G7 to Tandem and Omnipod and other pumps?
Yeah. So quite a few updates going on in the partner realm with Dexcom CGM. We've designed it to be ready-made for connecting to insulin pumps. I'm starting with just Omnipod 5. They've recently launched in UK and Germany earlier this year with the Omnipod 5 system. That is connected to G6 at this point in time. They're working on their G7 integration, but those are new introductions of that system to the European market. And then Tandem actually has just recently announced that they're planning to launch the integrated G7 Control-IQ system in the US and across Europe in a number of geographies before the end of this year. And so that's coming up here rapidly. We're in Q4 already. In the next, it's never been closer. Our integration with G7 and Control-IQ, so it's going to happen here, at any point in time, very, very soon. So we're very excited about that connectivity to G7 and bringing the benefits of G7, all of these of use simplicity to that group of users.
You mentioned when we're talking about the European markets. So this podcast is US centric, but we do have a lot of listeners around the world. Is Dexcom, pardon my ignorance, Dexcom G7 compatible with any pump system already?
It's not compatible with any pump systems yet, but the Control-IQ is going to be the first introduction.
Okay. I'm just trying to think of other, we're not the only pump systems here. We've got others right around the world.
Yeah, there are some others that are available in Europe that we do have G6 connectivity with, and we're bringing G7 connectivity.
Great. I did get an interesting question, and you may have seen this in the Facebook group, in Diabetes Connections, the group. Mike said, how long before G6 is discontinued and no longer able to be ordered in the United States? I asked this because I know you haven't announced any plans, certainly. And we saw the G4 and the G5 supported when there were pump systems that needed to work on those. There have been, I don't want to call them rumors, there have been some, I think, mistaken letters sent out from a few medical supply companies saying, you need to upgrade soon, G6 is going away. And those are coming outside of Dexcom. Can you speak to any timeline for discontinuation, or I guess reassure people it's not happening tomorrow? For many of you, as you listen, this is going to sound like a weird question. Why do you use the insulin pump you've got on right now? Well, there's a really good chance you went on that pump 15, 20 years ago because it's what your doctor had back then, and you've never really thought about changing. Well, that was us until Benny's pump company went out of business. I was amazed how much things had changed when we looked for a new one. I'm telling you, it is time to take advantage of what's new. If you need a sign to switch, this is it. Omnipod 5, the tubeless automated insulin delivery system, is here, and it's available through the pharmacy, which means you can try it today, even if your tubed pump is under warranty. Fill out the quick online form, see if you're eligible for a free trial. Go to diabetes-connections.com and look for the Omnipod logo for full safety risk information and free trial terms and conditions. Also visit omnipod.com/diabetesconnections.
Yeah, no, it's a really important question, Stacey. So it's not happening tomorrow. We're not discontinuing G6. What we are doing is encouraging anybody who's not using an AID system or isn't thinking about using an AID system in the very near term. We're encouraging all of them to start up on G7 or to upgrade to G7 just because the benefits of that product and our ability to ensure that there's plenty of supply of G6 for those that need it. And so we are encouraging a lot of people to upgrade, but we have plenty of G6 for those that need it. We're going to continue to support it until we have all of the AID systems upgraded and giving everyone a chance to get moved over to G7. So there's not planned at this point in time to stop producing G6. It just is, we do want people moving to the newest technologies.
So if somebody gets an email from their medical supply company, it's probable that they're not using an AID system or they're not using a system that relies on G6.
That would be my,
check.
That would be
yeah.
my question.
Okay. In other words, these guys aren't going rogue. There is a message from Dexcom saying, if you don't need it, if you don't need G6, you should upgrade to G7.
Yeah, that is our message. If we want people to upgrade or to start up on the latest tech. We want to ensure all of our users that need G6 for AID connectivity that we are producing it and have plenty of supply.
I'm sorry to chuckle when I said the medical supply companies are going rogue. That made me laugh for some reason. This was an interesting question. I was not aware of this. Carol asked, I'm curious about the issue with not being able to download the G7 app outside of your home country. This is a big deal for travelers if their phone dies while outside of their home country. Previously, U.S. travelers could just take a spare Dexcom G6 transmitter and sensors for an emergency. I have never heard of this issue. Is this a known issue?
It's not an issue. What it is, though, is that because now G7 is available in all these different countries, and it's basically connected to your account. So when you create an account in the United States, you have a U.S. account, and you have to download your app from the U.S. store. You can't go download the German, an app from a German store, because every just one point of reference is for mobile apps, whether it's Android or iOS, each country has a unique store. And so when you're in that country and your phone is connected to that system, you download the app from that store. And so the key is if you're needing to get a new phone and you're traveling abroad, you download from the US store. And there are times where the account kind of says, hey, you're a US customer, for example. And so it's having an issue with validating the account. In those instances, you basically just call our tech support and they can help out. They'll solve that problem for you. So it's really just, and we're working on systems to improve that to basically make it more automated. But it really stems from the architecture of our new system that allows us to use one mobile app across the globe that configures based on your account. The benefit of that is that we're able to bring all the new features of G7 to all users around the globe as soon as they're approved in the different geographies. And so we've been putting out these rapid G7 versions across the world. It's not just like within the US or within European countries or anywhere else. But that is the answer to that question is if someone's traveling there is a workaround for it, and our tech support can help.
Great to hear, because I had not known that was an issue, and we were very fortunate to travel internationally sometimes. So we're not on G7 yet. There was a rumor going around, and there were some posts that got removed that Dexcom had, quote, recognized the issues with signal loss on the G7 and are now shipping sensors with a stronger transmitter. Any truth to that?
Well, what I'd say is we're always enhancing G7, right? So we just got it out the door. And so we have made improvements to the product, both the mobile apps and the hardware. I think the G7 as launched in the configuration works fantastic. We're seeing great results, but we're always trying to make it better, right? And signal loss can happen. You walk away, or sometimes I've had experiences where sometimes I have to reset the Bluetooth on my phone every so often, which is not unique to G7, right? G6 had some of those same issues would come up, but we're always striving to make it better, and so we have made improvements to the devices and to the phones, and we're going to keep doing that over time because the G7 platform is fantastic. We're going to continue to invest in it.
Talk to me a little bit about Dexcom One as this continues to roll out in different countries. I thought I read recently that it might be able to be calibrated, or the user might have a bit more control over Dexcom One.
Yeah, that's a great question. So actually at the conference yesterday, as part, just following the presentation of that commissary data, we presented for the first time Dexcom One real world data. So a clinical study that was run in the UK, which is one of the countries where Dexcom One is available. And it was run in people with type 1 and type 2 diabetes on multiple daily injections of insulin. So these are intensive insulin users. And we saw just within a 6-month period, a 1.5% reduction in A1C in this population, basically showing the benefit that Dexcom One can have. It's the first time that the actual product that was commercialized has shown an outcome data. We obviously knew it would, but this study actually shows it. One of the features we actually just released in Dexcom One this week is an update to the mobile app that allows you the user to calibrate it if they'd like. The original configuration Dexcom One didn't have that functionality, but based on user feedback, they requested the ability to do that. So we made an update to that. So that's just rolling out this week. It's a staged rollout. So people, if they don't see the update today, within the next couple of weeks, it'll definitely be there.
We've talked about the Follow app for many years. I had a whole bunch of requests. I don't even follow Benny anymore. So my requests were not granted. Too late for me. But I did get a couple of questions from parents who were curious about if there would ever be a feature, if you're exploring this, that was some kind of caregiver option that they could turn off and on at certain hours. In other words, you can see plainly kid goes to school, the school nurse is following on her phone, the school nurse goes home, doesn't want an alert in the middle of the night. Is there a way perhaps in the future to accommodate for different caregiver schedules on a Follow app.
Yeah, I think it's a great idea, like basically a profile specific to when you want to be, because right now we have the profiles around alerts, right? But actually, kind of suspending Follow. The person wearing the CGM can do that, but on the Follow side, you have to go out and turn off all your notifications. So I think it's a great option to explore. I had not heard that. And there's a lot of things we're exploring right now for Follow because we do want to continue. We've been so focused on getting G7 and Dexcom One, the whole new mobile app infrastructure and completely new software out the door. But now we're turning our focus back to Follow. So that's a great recommendation from your audience.
It's a really interesting issue. We never shared with school personnel with Benny because he was in middle school by the time Follow was available. And it just didn't make sense for the way we managed. But I was always uncomfortable thinking like, again, the school nurse is going to go home. If we forget to turn it off, she's going to perhaps judge me for not being the perfect diabetic parent, or she's going to be woken up in the middle of the night unnecessarily. But a lot of school districts don't allow their personnel to follow on their own personal devices for many, many reasons. So I think it's really interesting to look at all of that. It is incredible. Jake, you and I have been talking for a long time to think about how far and wide this issue has changed now and the decisions parents have to make and schools have to make where this didn't exist less than 10 years ago.
Yeah, the utilization of the Follow system remote monitoring has just changed so many people's lives. It's also brought some of these questions around who's following who. I remember one of the customers I talked to who was a teenager when we first introduced the product was talking about the rules of engagement around Follow within his family. And when, he was uncomfortable all the time with the following. And so it was, everyone we basically try to make the tools configurable as possible so that, it can meet everyone's different needs. But it is, hearing those stories around people who used to have to go to school and finger prick or check CGM's devices before. It's incredible technology. And now there's millions of people that use it around the world.
Yeah. I have a whole chapter in my book about the rules of engagement around CGM because you got to have those conversations. Got to have them. Before I let you go, I always love to talk about direct to watch. I feel like I'm going to get you a watch when this is possible. Maybe but can you give me an update on that in terms of either timeline or just kind of revisiting the issue for people who are perhaps not familiar with why this is so complicated?
Sure. So I'll do a couple of things. One, I'll just kind of just discuss the topic and what the team's been working on for, as you expressed, quite a long period of time. The idea here is that, the watch, when it goes direct to watch, that watch becomes the primary display device that is responsible for all glucose alerts and alarms. And so that's one of the most critical safety features of a CGM is for it to be able to ensure that alerts a user when their glucose is out of range as they expect it to. And so ensuring that a watch in any configuration of coming in and out of range of a phone, in and out of range of the CGM, when you're charging the watch on a stand, there's a lot of places where there were opportunities in the original system architecture, between Apple's, the way the OS on the watch works and the way that our app on there works, for that to, not be a reliable reliability issues basically with alerts. So that's why it's been in development for quite some time, is ensuring that we get to the reliability that we have on all the other received devices. I'm happy to say, though, that there are products in testing right now that we feel commercial version of Direct to Watch. We built Direct to Watch capability into the G7 hardware so that as soon as the app was available for the watch, that the firmware on the devices on G7s would work with it. We do expect to get that feature out next year. It is something that has to get reviewed by the FDA. It's a filing because it is some of the safety analysis and all that you do because it's a received device. So, but we're super excited and we feel like we're extremely close to being able to our users.
All right. So tough question. I'd love a real answer to this. So when Kevin Sayer announced in June, direct to watch by end of year to that audience at ADA, what was your inner thought? You just said next year for a watch. Did you were like, oh, why did he say that? Or was that planned? Did he just was he just excited?
No, I think, it definitely is our plan to submit it before the end of the year. But when it actually becomes available is kind of around, we get it cleared by the FDA. There's a review time that's kind of the experience with G7. There's we don't always know how the reviews take. Sometimes there's questions that the reviewers have that we have to kind of close out before they approve the device. So no, but yes, Kevin's excited about it. We all are definitely excited about bringing that technology out. I've been actually using some of the prototypes, experiencing it, and it is pretty exciting when you can just walk away and have the watch continue to work.
So I conflated submitted to out and usable. That's what he was announcing was submitted. All right, you got to go, but I got to ask you, at the same meeting at ADA, you guys talked about a type 2, a CGM created for the type 2 market for people who do not use insulin. We'll talk about that at a separate time, but still on track for next year?
Absolutely. Yep. That's a big development going on within Dexcom, and very excited about that product unique feature set. It's different than the G7 and Dexcom One products. And so, can't wait to get it in users' hands.
Great. Well, Jake, thank you as always for going through all these questions. I really appreciate it. Safe travels and enjoy the rest of the conference.
Thanks, Stacey.
You're listening to Diabetes Connections with Stacey Sims.
I will link up more about Dexcom at EASD and some of the other things we talked about over at diabetes-connections.com. Every episode has its own homepage. If you can't find the links in the podcast player where you're listening, because I know most of you listen that way, you could always come on over to the website and hopefully find everything you need. Coming up next, we are going to talk about wins and fails. I saw something in a Facebook group that I have not seen before for diabetes. I want to share this with you. It is a win. It's a good thing. Coming up next. Diabetes doesn't always have to interrupt your day. Dexcom G7, a continuous glucose monitoring system, sends your glucose numbers to your phone or receiver. Know where you are and where you're headed without finger sticks and without interruption. Dexcom G7 is the most accurate CGM, and it's covered by Medicare. Learn more, go to diabetes-connections.com and click on the Dexcom logo. Finger sticks required if symptoms or expectations do not match readings. See user guide for instructions. Must meet coverage criteria. For full prescribing information on risks and benefits, visit Dexcom.com. For a list of compatible devices, visit Dexcom.com/compatibility. Wins and fails this week. A big win when you find some diabetes supply stuff right on a regular old store shelf. I remember when Benny was diagnosed and they told me I had to use a supply company and we had to order stuff and we couldn't get Opsite FlexFix. Any of you use that? Like I had to order that from Amazon. And I was so confused and so overwhelmed. And I just was like, can't I go to CVS and pick up some pump patches? And of course you can't because they don't do that. Well, they do. Thank you, Janine, who posted in a parenting group on Facebook, Walmart, $7, something called Second Skin Continuous Glucose Monitoring Patches. It says right on the front, compatible with Dexcom G6. She said it was $7 in the store. I found it online for $8.97. I don't know how well this sticks. It looks like it just comes in black, unlike a lot of the online options that come in so many colors and patches and shapes. But the point of all this is something that you can walk into a store and buy. And I know it might seem like a little thing, but to me, this is huge. I will say something we did on and off for years. If Benny was worried about his Dexcom or any of his stuff coming off, you really can just slap a Tegaderm, any brand, clear, waterproof Band-Aid over it. And that works really well in a pinch. And my fail this week is that the perception of type 1 diabetes as a childhood or juvenile condition is still out there among the medical community. A new write-up suggesting that up to 62% of type 1 diabetes cases develop after the age of 20. Of course, these writers go on to talk about how adult onset type 1 is frequently misdiagnosed. But what really gets me going is that they talk about how this is such a surprise to the medical community. And I get it, right? But we have had study after study show this same thing. I don't know how many years ago it was now, 5 years ago, that there was this study that talked about something like 30% of adults with type 1 are misdiagnosed for more than 2 years, some up to a decade of misdiagnosis. I know thinking evolves and things change, but it makes me upset because I think about all the education and care and sympathy that we got when Benny was diagnosed at 23 months. And I feel like, he's almost 19. If he were diagnosed in the next couple of years, not only would the education be completely different, the care he would get, I can't imagine we'd get 3 days in the hospital with all of the visits from doctors that we got. But the public sympathy, quote unquote, or understanding about diabetes is so different for adults, regardless of type. So that's my fail for this week. And I will have more on this study and many more in Friday's In the News episode. Thanks as always to my editor, John Buchanan from Audio Editing Solutions. Thank you so much for listening. I'm Stacey Sims. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.
As you're managing life with diabetes, Edgepark is here to support you on your health journey. Discover convenience and peace of mind with Edgepark, your trusted supplier in diabetes management supplies. Edgepark has a wide variety of pump and CGM solutions from top brands to fit your unique needs. Plus, Edgepark works with most insurance companies and handles the paperwork to navigate insurance complexities for you and make the ordering process as seamless as possible. You work hard to manage your diabetes. Let Edgepark take care of the rest. Go to diabetes-connections.com and click on the Edgepark logo.